Wedged in the middle of Jamaica's rural community, along Golden Avenue, lies a remarkable institution, a haven, a safe place where countless individuals have come to seek answers, treatment, and hope after a life-changing diagnosis. For many, it's not the end of the road, but the beginning of a new journey, a path forward, paved with comfort, compassionate care, and quality treatment. This is the Hope Institute. Launched by the Jamaica Cancer Society, the Hope Institute stands as a testament to Jamaica's unwavering commitment to providing comprehensive care, from diagnosis to treatment and recovery, strategically placed to serve those most in need. This institution addresses the rising numbers with a mission to deliver critical care and support.
When I first came to Hope in October 2002, I'd been doing my training in the UK, and so I came home, which was great. And I really wanted to use my skills that I'd been trained in. And when I came to Hope, I was literally the first doctor to be based at Hope. As you probably know, the physicians that looked after Hope at the time were based at KPH, and then they would travel up to Hope to look after the patients, do ward rounds, and often the patients would be put in a vehicle and taken to KPH. So it was a new thing to have a doctor actually based at the Hope Institute. And one of the things that I was very interested in was developing the palliative care side of oncology care that really was very germinal at that time. So over the years, what I was able to do was to actually build a team. So, I was here by myself for a few months. I appealed to the region that we needed more help. And gradually over the years, we have moved from one doctor to a team of 2 senior doctors and 4 medical officers.
The institution stands as a beacon of hope, offering vital services such as radiotherapy, chemotherapy, terminal and respite care, symptom management, and counseling.
They started this place because at the time, like now, persons who are able to afford cancer care traveled to the US and to Europe to receive their therapy. So they thought that it would be a good idea for patients to be able to access the same service at a location in Jamaica. So they started this place as a free institution for patients with cancer. So in 1963, when they started this place, the patients, it was for a curative intent, not for what we're doing now. We have gone into palliation and chemotherapy. It was a curative intent. So the patients who are here, they are patients receiving radiotherapy. So the patients would stay here and get radiotherapy at KPH. At the time, the funding was from NGOs. So over time, with expenses and so on, they started to get help from the government through the Kingston Public Hospital, University Hospital, and with private donation. So the Cancer Society had this place for about 10 years. However, they ran into financial problems. So in 1974, the institution was taken over by the Ministry of Health, now government of Jamaica.
The Hope Institute Hospital is a cancer hospital. It is the sole hospital in the English-speaking Caribbean which has been dedicated solely to cancer patients. So you go to other hospitals, they do some cancer, they do some surgeries, they do some gynae stuff, medicine stuff. Our sole purpose is for cancer patients.
With a dedicated team, the Institute provides personalized support, tailored to each patient's unique journey. While collaborating closely with the Kingston Public Hospital and the University Hospital of the West Indies, the Hope Institute ensures seamless, high-quality care throughout every stage of treatment, for at little or no charge to cancer patients.
The services we offer are tailored to cancer patients. The main service we're offering right now is outpatient and inpatient chemotherapy. Whether you are a patient who wants to be cured or whether you're a patient who is on the palliative journey. And on that note, I like to say that we also offer palliative care to patients. Unfortunately, not all cancer patients are going to be cured, but they may be here with us for a short or long period, and we are here to help them along that journey, giving them chemotherapy, giving them pain medication, and also more recently, we have added an internist to our team, so we're able to manage their chronic diseases such as diabetes and hypertension. What we also offer is a collaboration with the St. Joseph Hospital, where patients who are receiving their radiotherapy at the National Cancer Treatment Center located at St. Joseph's, we manage them as an inpatient here. Many of them also have chronic illnesses. And not only do they get their radiotherapy and come back, but we manage their dietary needs, we manage their social issues, we manage their psychological issues. So what we do here is a holistic approach to cancer patients. The Hope Institute Hospital, when it was first established, could initially house 50 patients, house 50 beds rather. But in a need to get our administrative staff on board, our nursing staff on board, and our doctors on board, they needed a place to stay. So we didn't have the physical infrastructure at the time to accommodate the staff that was needed to take care of the patients. So what we did was convert some of the wards that we have into rooms that we needed, conference rooms, nursing rooms, etc. So it moved from 50 to about 40, and currently what we are realizing, the change of medicine, we had a lot of palliative patients currently being admitted, right? So we moved from 50 to 40, and palliation is going back into the community. So, and we're trying to reach out to the community, meaning if you're a palliative patient and you can be dealt with at a location closer to your home, we try and see you here and you go back to your home.
The Hope Institute certainly stands as a symbol of hard work, compassion, dedication, and commitment, with the vision to provide not just medical care, but support, fostering healing and guidance.
The goal of the Hope Institute is one of the facilities that looks forward to pushing the center of excellence in oncology care. We move forward with ensuring that we treat not only the patient, but also the relatives, because in situations where persons have been diagnosed with cancer, the family members are also important to understand the procedures required and also what is necessary to ensure that their patient or their relative gets the best outcome. The most significant achievement of this facility is that we ensure that every patient feels at home when coming to this facility. As you would have seen today, this facility does not feel like a hospital, or does not give the impression that you're actually in hospital, but more in a family setting. One of the greatest achievements of this institution is to ensure that patients who come here have a line of hope, just as the name states. So when you enter Hope Institute, there is always hope and that drive to ensure that you come out and you ensure that you have the best life possible while fighting cancer.
Response from the general public has been good. Patients who are admitted here, sometimes when they're coming, on admission, sometimes they'll cry on admission based on what they hear. The perception out there, once you're diagnosed with cancer, that is the end for you. However, when they're oriented to the service that we offer and also the quality of nursing care that we give, when the patients are actually leaving, they also cry, because it's usually sometimes very difficult to reintegrate into society, because at Hope, all the patients have cancer.
This facility addresses not just the physical and mental health of its patients, but also nurtures their spiritual well-being. Here, healing is holistic.
Cancer is a diagnosis that has physical and psychological implications, not only on the patient, but on the patient's caregivers, the family members, the next of kin, whether you're blood related or not. So what we try and do is keep our environment green, If you look on the wards, we have a lot of windows to allow the patients to view the scenery, to feel at peace. You know, the color green allows you to be calm. Not only that, like I said, we have a psychologist who comes and sees our patients. And they don't only see the patients, they see the patients' relatives. The social worker plays a similar role. Although they are dealing with the behind the scenes aspect of the social implications or impact that the patient's diagnosis may have on the patients themselves and the patient's family, they also offer a significant amount of counseling. The doctors as well, and most importantly, the nurses. The nurses are the ones who are with the patients most of the time. So yes, we have official counseling from our psychologists, from our social worker, from the doctors, and also the nurses. And we don't only treat the patients, we actually treat their relatives. Most patients who pass through the Hope Institute, and I say most, because I can't keep track of all patients, but most patients, they enter the institute, you know, petrified with a lot of anxiety. And then as you see them through this journey, they start to relax, they start to open up. So generally speaking, I can't put a percentage on it, but the feedback that we have gotten is, oh, Dr. Alexander, our nurse, you know, when I initially came here, I thought it was just so dead people I was going to see. You guys have been like a family to me. So that's why it's also easier for us to follow up. So you guys have been a family to me. Also, the patients come up here and they form bonds with other patients. I've even had several patients saying, okay, I want to come every time when that patient is coming. So we have to book our follow-up clinics on the same date for this patient. So let's say I was giving this patient a 5-week follow-up appointment, and I give that patient an 8-week follow-up appointment. After say, all right, guys, we're going to give everybody an 8-week follow-up appointment, or we're going to give everybody a 5-week follow-up appointment, just not to disrupt that bond. And unfortunately, we do have patients who pass from time to time, and the other patients are so distraught, you know. So from the feedback that I have gotten, and most of the staff can concur with this, is that they come here anxious and they see what we're all about. They drop the guard, they let us into the heart, they accept the treatment, and they just fall in love with the place. So that's most of the feedback. Not all feedback is going to be good, but generally speaking, from what I've heard, that is most of the feedback.
This mission is all about making every patient feel valued, supported, and empowered.
What I can say to the public, fear not, because we have nurses here. Well, I have 29 years of service at Hope Institute, and most of the nurses have 15, 16, 19 years of service. And the nursing staff, they're highly motivated and raring to go. So once you come through these doors, there's no need to worry. And with our Nurse Navigators program, we hope to educate the public, because to me, the only answer to me right now is for persons to be educated, because there's this high level of health illiteracy. A lot of persons don't know what to look out for. You have changes happening in their bodies, they don't know. So these nurses will help in the education of these patients and potential patients, because we want to take the patients throughout all the stages, even before diagnosis, if we're able to meet these patients, because you find that once you get in early, there's a chance for you. And also to encourage them that once you're diagnosed and you get to Hope Institute, there is hope for you.
The Hope Institute remains dedicated to its vision, working together to achieve excellence in oncology and palliative care. Its goal is to become the hospital of choice by delivering superior services to patients at every stage of their cancer journey. And with all that said, the vision is clear: working together to achieve excellence in oncology and palliative care. The Hope Institute strives to become the hospital of choice, by providing superior services to patients at every stage of their cancer journey. This hospital not only transforms lives, but also inspires a community to unite against cancer. Here, every patient's story is a testament to the power of care, collaboration, and resilience.